97, 55 KRCD Talk Station. Blood Cancer Awareness Month. It is September, and it is Blood Cancer Awareness Month, and anybody who listens to me knows that's the kind of cancer I have, lymphoma. And joining me in the 55 KRC Morning Show from OHC, my cancer doctor, Dr. Kruti Patel. Dr. Patel, great to see you again. I'm glad it's in a non-clinical setting. I love when OHC comes in, not because I have a love for cancer. We all know that it's the one unifying thing in the world. We all hate cancer, but because you always have positive information in terms of research and therapies and treatments. We'll get to that in a minute, but let my listeners know to start off, since you are an expert, a medical oncologist, you deal with bone marrow transplants and cellular therapy and hematology. What's the difference between lymphoma and leukemia?
So lymphoma and leukemia are both blood cancers, and they have some overlap. But lymphoma is a blood cancer that involves your lymphatic symptoms. And so you have lymph node enlargement when you present. Leukemia more so involves your blood and your bone marrow. They both have some symptoms that are overlapped. The more common lymphomas that you hear about is Hodgkin's and non-Hodgkin's lymphoma. Among the non-Hodgkin's lymphoma, you have your B-cell lymphoma and your T-cell lymphomas. Among the leukemias, there are two different big categories, acute leukemia and chronic leukemias. Acute leukemias, you have acute myeloid leukemia and acute lymphoblastic leukemia. Among your chronic lymphomas, you have more common ones are chronic myeloid leukemia and chronic lymphocytic leukemia. CLL is where I remember going back to. That's the blood cancer that can behave as a leukemia as well as a non-Hodgkin's lymphoma. But for the most part, we call CLL, it's its own category of blood cancer.
And I would presume, but depending on which one of these different blood cancers you have, it would involve a different treatment protocol, correct?
Yes.
And are some more likely, are more deadly? I hate to use that word, but we got to be realistic here. We're talking about cancer. Are some more problematic along those lines?
Yes, the acute word in the leukemia is the most dangerous one, the acute AML and ALL. If we don't treat patients with these leukemias, their mortality is less than 30 days. So it's a pretty serious.
Do they metastasize to other parts of the body?
So it's a blood cancer. It's present in your blood system. Rarely, about 15% of the time, you can have AML in your solid organs like lungs or your stomach. But for the most part, it's in your blood and your bone marrow. All
right. So I struggle with the one thing that I struggled with in not knowing before I was diagnosed with cancer, night sweats. I had no idea. My entire life, I didn't night sweat, and then all of a sudden, I'm waking up in the morning and the sheets are just soaked. My wife is like, "What is wrong?" No idea. And finally, ultimately, by a long time passed, but finally, this ultimately through another completely different set of circumstances with a completely different medical procedure, I realized after a CT scan that's where the red flag came up. It appears that you have lymphoma. But night sweats? But there are other things people need to look out for. And what are those?
Yes, for lymphomas and leukemia as well, some of the common symptoms that we see in patients is they're just really tired. Fatigue is a very big complaint. Night sweats as well, more common so with lymphomas than leukemias, but you can see that with both. And you're not just talking menopausal hot flashes kind of night sweats, drenching night sweats, where you're waking up with your T-shirt soaked in sweats. Yeah.
It's weird.
Yeah.
I mean, I don't know how else to describe it.
Scary, yeah.
But, there's fatigue and there's fatigue. I mean, I can claim that, I struggle from fatigue.
We're all fatigued all the time.
I know. See, that's the tough one to really, is it bad enough or is it, specific enough that I need to talk to someone like you, Dr. Patel?
Right. I always tell my patient if it's a dramatic change in your fatigue, like you were walking 3-4 miles a day and then now you can't even get out of bed. So a dramatic change over a short period of time, that's concerning. Along with other symptoms, so unintentional weight loss. If I know we're all trying to be healthy, losing weight.
Yeah,
but
I didn't get that one. Sadly, I know it's not something to joke about, but
right.
that would have been okay with me.
No, this is not a weight loss journey, but dramatic weight loss without trying, 10, 15 pounds within a month. Leukemias, a lot of times patients are feeling fine. They're athletes. They're running 5 marathons, and then suddenly they're just severely fatigued, lightheaded. Easy bruising is one of the common ones we see with acute leukemia. So spontaneous nosebleeds or big bruise on your thigh without really having any trauma. Those are some clinical signs showing that your blood counts are low. So a lot of the symptoms you think about are because your white blood cell count, red blood cell count, and your platelets are going to be low with leukemia. So risk of infections with your white blood cell count being really low.
Now, with leukemia and lymphoma, is it possible to diagnose with a blood test?
Yes, there are certain labs that are concerning. So I mentioned, leukemia, you have low blood counts. So if you had a normal CBC 6 months ago where your blood counts were completely fine at your primary care doctor, and then you have these symptoms and you're coming to either the ER or seeing your primary care doctor, and you suddenly notice a drop in your hemoglobin or your platelets or your white blood cell count, that can clue you into thinking something's wrong, something's going on. But most leukemias require a bone marrow biopsy for diagnosis because that's where the cancer originates from. As far as lymphoma, not always does it shows up on your blood work. When you and I see each other, your blood work counts are always normal. And a lot of times lymphoma patients, their CBC is normal, but they present with these symptoms. And typically we do CAT scans to see if their lymph nodes are enlarged, or a physical exam where we palpate feel your lymph nodes and notice any growth in them.
All right. Well, I'm sure my listeners by now could identify the risk factors, which include previous chemo, radiation, genetic disorders, exposure to toxic chemicals. Tobacco is always on the list, and, of course, family history. I want to jump right to treatments in the remaining time if we can.
Yeah.
What are we talking about by way of treatments that are going on? Because it's usually really exciting.
Yeah, my goal is always to minimize the toxicities and the chemicals I put in my patients to try to cure them of their leukemia or lymphoma. So in the past decade, we've had a lot of immunotherapies that don't involve chemotherapy-based regimens. So CAR-T, which is basically taking your immune system to help fight the cancer, has been approved for leukemia, certain leukemias, and especially lymphomas. There's always, for acute leukemia, we've had stem cell transplant as potential procedure for cure, and Jewish and OHC has been doing that for 20 plus years and very successful. And then standard of chemotherapy, immunotherapy is also treatment options. So it really, we look at the patient as a whole and decide what would be the best treatment choice for that patient.
Well, if you have any questions, more information, you want to schedule an appointment or get a second opinion, say it all the time. Give them a call, 888-649-4800. That's 888-649-4800. You can learn more online at ohcare.com. Dr. Patel, thank you so much for taking care of me and all your other patients at OHC. And hopefully we'll never have to see each other in a clinical setting again. I'll be 4 years cancer-free in November as long as I remain symptom-free. And that puts a big smile on my face. And I know you've got a lot of patients that feel the same way. So thank you very much for what you're doing.
Thank you. Thank you, Brian.
OH